Hello, everyone. This is Dr. Dorette Nurhassan, practicing reproductive endocrinologist and infertility specialist in the Dallas-Fort Worth area, as well as author of Miracle Baby, A Fertility Doctor's Fight for Motherhood, and the Fertility Manual, Reproductive Options for Your Family. Here today with Dr. Sadas Sagir, a pediatric gastroenterologist in the Dallas-Fort Worth area. Dr. Sagir, welcome to the show.
Hello, Dorette. Hello, everyone. Thank you, Dorette, for having me on the air. I'm really excited to spread the word about and my knowledge with the newborn babies, moms, and help them out. So I'm a pediatric gastroenterologist, and by pediatric gastroenterologist, I have been trained to take care of the pediatric baby kids anywhere from newborn or premature to 18 years of age. I take care of any issues related starting from mouth all the way to the issues with their guts, not able to take anything by mouth, having diarrhea, constipation, feeding intolerance, throwing up, weight gain or weight loss issues, anything related, you name it, and GI related. I am with a pediatric, as a pediatric gastroenterologist, I'm part of a group, Digestive Health Associates of Texas. And you may have seen some signboards stating DHAT. So I'm the pediatric gastroenterology version out there. Our main office is in Arlington. I do have satellite clinics in Mansfield and North Richland, but during COVID, we are kind of right now working mainly from the Arlington location. However, during this COVID, I am providing televisit as well as clinic visits also, able to see the patients within 24 hours and pretty much take all the commercial insurances, TRICARE, Medicaid, traditional, and AmeriGroup as of now, self-pay, and just able to provide help within 24 hours. Our office number is 214-630-4320, and our fax number is 469-713-8064. Our website address is www.dhat.com. So pretty much serving all the DFW area. I do have affiliation with Medical City Arlington, Children's Hospital Plano, and Medical City Dallas. So if you are living in a farther out area, we are able to provide help within those closer locations in terms of procedures.
Oh, thank you so much for giving us such a great description of what you do and where we can find you. And you brought up several clinical diagnoses as you were discussing the various GI problems that you treat in the pediatric population. One of those is feeding intolerance. I'll tell you, I have lots of patients. I help them get pregnant. They're incredibly happy. They deliver their babies, and then they take their babies home, and it's a joyous moment. And then they realize there's some feeding intolerance. For those of my listeners who have read my book, Miracle Baby, A Fertility Doctor's Fight for Motherhood, you know that my son had a significant intolerance to dairy, requiring several ER visits and ultimately a NICU admission. So it can be really devastating to first-time parents to see their newborns go through feeding intolerance. Can you tell us a little bit more about feeding intolerance, what causes feeding intolerance, and what signs and symptoms should new parents like myself look for?
Sure. Dorit, this is a very most common, especially in the newborns period that I see the complaints, and especially it is very disturbing for the newborn parents. First of all, they themselves are adjusting to the newborn and they're scheduling, and now you have a baby who your main thing is trying to make them grow and stay calm, but now you start seeing problems with the feeding. So let me start with the basics. So what happens as a baby, obviously, whether you are premature, if you are premature, your gut sensitivity increases, right? If you are full term, you are doing well, but if still if you have a cow milk protein allergy, that's where the problem comes. Whether you are doing breast milk or you're doing formula feed, so there is a difference. I'm going to start with the breast milk first. If you are doing a breastfeeding on the baby, the issue comes when mommy is drinking the cow's milk. All the basic formulas and the cow's milk is the protein. Some parents, they get confused whether it is the lactose, so they start drinking lactose-free milk. It's not the lactose. Lactose is the sugar part of it. It is the protein part of the cow's milk that the baby is not able to tolerate. So if mom is taking dairy in their diet, so what happens, the proteins passes through the breast milk and it start irritating their gut lining. Now, if this is through the breast milk, breastfed baby, the same symptoms will be pretty much similar, whether it is a formula-fed baby or the breastfed baby. The difference is if you are a mom who is breastfeeding, then you will have to avoid dairy in your diet. And if it is a formula-fed baby, then we will have to do a different formula for the baby. Along with the dairy, cow's milk protein, you have to take into account that sometimes the soy protein, pretty much when you are taking in your diet, mom is taking in her diet, I tell my parents that you need to avoid taking soy as well, because there is a 60% population in the babies who, when you are taking soy, their body takes soy protein just like a dairy protein and will start showing the same symptoms, okay? Now the symptoms, what happens initially, most of the times when the baby is discharged, parents' main complaint is that baby was doing fine for the first week of life, and later on by the third week, 4 week, it starts having symptoms of fussiness, gassiness, arching back, diarrhea initially. So baby poop should be like a normal pasty poop. You start seeing a liquidy poop, some mucus in the poop, blood in the poop. These are all symptoms. Or baby initially taking the formula very well, but now even in the middle of feed, baby start being very fussy or trying to avoid the feed. These are the symptoms that baby is, or the signs baby is showing you that I'm not able to take this, or this feed is bothering me. Now, once you start, for a breastfeeding moms, once you start avoiding these cow's milk in your diet, it takes 2 to 3 weeks for your milk to be protein free. So what do you do meanwhile? Meanwhile, then what we can do, while you do plan to breastfeed, you will have to continue pumping, because if you don't pump your milk supply will go down. So meanwhile, you can pump your milk and start storing it for later use, because this cow milk protein allergy, which means that cow's protein that the baby is taking is kind of allergic to it, I would say around 70% of them outgrow by 12 months of age. And a little person, 70 to 80% grow out by 12 months, another 10, 15% by 18 months of age, but most of the time by 2 years, they have outgrown it, okay? So you already know the time frame now is for next 12 months, mom has to avoid dairy and soy in her diet. If it is a formula-fed baby, okay, or sometimes mom, they have to go back to work and now they are trying to switch to the formula and you are having these symptoms, then we do a completely broken down protein, which means the big piece of protein, which is found in almost all the basic standard formulas. Then there are special formulas, either partially broken down formulas or completely broken down formulas. By the time these patients are coming to me, they are already sick enough where they are started to lose weight, or they are just not tolerating it, they are fussing, having blood in the poop, or just watery diarrhea, I directly put them on a completely amino acid based formulas. So what happened, these formula, they easily get absorbed in their gut lining, and by the time in next 2-3 weeks or 2-3 weeks, their symptoms slowly starts getting better. So this is the most common reason in the very first few weeks of life, you will have a problem in babies having feeding issues. Sometimes this has been taken as this could be a reflux disease. Yes, reflux vomiting can also be a symptom of cow milk protein. So before we start putting them on a medicine, it is always better, the guidelines are to let's fix the formula first or the feeds first, what the baby is getting. If the symptom still persists, then we go down the route of medicine.
Oh, that's so fantastic. Thank you for educating us about the various types of feeding intolerance, because it's pretty traumatic to new parents when their babies go through this. Another thing that can be pretty traumatic is when the newborn has changes in the bowel habits. Can you tell us what's normal, what's abnormal? What should we be looking for?
Sure. Yes, and welcome to the motherhood. So now with the newborn, basically, because as they're newborn, their gut motility and everything is very kind of still adjusting. Their still body rhythm, everything is just adjusting. Within 24 hours of birth, you don't expect them to be completely have a proper rhythm. Or the motility, which means the movement of their gut, how they are tolerating the feeds. There will be a difference when we are talking about premature babies or the full-term babies. I'm going to first talk about full-term babies because these are normal, healthy babies, have no issues. A normal full-term baby, usually they feed, and then they have a bowel movement, and it can be yellow pasty. In a breastfed baby, you will see a little bit of seediness in the poop, which is totally normal. It's yellow, seedy poop. What is abnormal, if you ever see red color or the blood in the poop, okay? If you ever see the poop has started, the color have started gradually fading away, that is a very significant, important finding. If that is happening, you have to go to the doctor right away, because then we might be talking about some liver issues, okay? And these things have to be taken into account within the first, especially the first 2 months of life. Up to 6 weeks is the most important one. Poop color turning to white color is very urgency, okay? Now, usually newborn babies feed every 3 hours. So you can imagine every 3 hours, they may go anywhere from 6 to 8 times a day. Dirty diapers can happen. Their wet diapers can be anywhere from 5 to 6 or more than that per day. Once the baby turns from 4 weeks of age to 6 weeks, they're transitioning, their bowel habits may change. It can change anywhere in the 2nd month of life or the 3rd month, which means while now you have a baby going from 7 times a day to maybe 3 times a day. And by the time they're in 3rd and 4th month, it can happen once a day. As long as baby is pooping daily, and the belly is soft, baby is not like arching back or having fussiness or very distended abdomen, we are okay with the bowel, because every baby is different. It's not like black and white, but these are the symptoms you just have to keep in mind. It's not hard pellet poop. The poop is pasty. Formula fed babies can have a very dark green color pasty poop, which is normal. As I said, red and white are not a good sign.
Oh, fantastic. It's so good for you to tell us about the changes in the bowel habits in the newborn. Are there other things that our listeners may want to hear about in the newborn, particularly in the pediatric gastroenterology world?
Yes, and I need to mention about bowel habits, especially about the premature baby. So whether the baby is 36 weeker or a 25 weeker, obviously initially they might be in the ICU. By the time they are discharged, they go home. Premature babies tend to have problems with pooping. They may still have a soft normal poop, but instead of having daily, they can go every 2-3 days, or they may get very uncomfortable. This may or may not be related to the cow milk protein allergy. Then we think more in the direction of motility, because since they were born prematurely, so the nerves which are responsible for the gut motility, like it moves like this, what happens, they are slowed down. So we do have to use medicine in those babies for 6 to 8 weeks. So keeping that in mind, that there are motility issues, there are formula intolerance issues. Another thing, what can sometimes happen is, besides the bowel and the feeding intolerance, if your baby is not tolerating rice milk by the time baby has turned into about 6 months of age, right? And not tolerating the rice cereal, then try the oatmeal cereal. And if the baby, even prior to 6 months of age, start having too much of the reflux, do discuss this with your doctor. But as a GI, sometimes what we do, we recommend them adding just a half a teaspoon of a cereal per ounce of either the formula or the milk. Okay, this kind of makes the feeds a little bit heavier and prevent from the reflux. And making sure every time you feed the baby, burp it in between the feeds. And when in a newborn period, you have a baby who has tendency to throw up, when you wrap them up and swaddle them, don't put them on their back. You have to put them on sideways position. So just in case they throw up or have a reflux, it comes out of their mouth and they do not choke on it.
Fantastic. This is such good information. Are there any last words you want to leave our listeners with?
Well, yeah, first of all, I am really thankful, Dorit, for you having me on this. And anyone who needs, who feels like that there is issue going on with the newborn baby or their child, I feel as a parent, I can tell that have your foot down and just reach out to the doctor and seek the medical advice. Don't sit on it, especially in babies. What happens GI system, which means vomiting and all this, can be the initial symptoms of not only the GI problem, but from other issues also. They can start having a fever, they can start having diarrhea or other illness, and that could be the first symptoms due as a throw up. Like urine infection in newborn babies can also start showing up as just a throwing up. So have a full evaluation. Your feel like your baby is not gaining weight, again, these are the main things you have to keep in mind. I am as a PDGI always at your service, and you can easily, once again, I'm gonna go over our office number, 214-630-4320. I'm with Digestive Health Associates of Texas. Happy to offer televisit within 24 hours and take care of your child.
Thank you, Dr. Sagir, for being on the show. Thank you, everyone, for listening. Bye.
Bye-bye.